Hello, thank you so much for joining another episode of Celeste the Therapist podcast. My name is Celeste, and we have a special guest. I'm going to ask Donna to introduce herself to you all. Donna, can you introduce yourself to the audience, please?
Sure. I'm Donna Torrisi. I live right outside of Philadelphia, and I'm a nurse practitioner. I've been in practice since 1976. And more recently, I ran a network of community health centers in Philadelphia for 27 years. I retired from that 2 years ago, but I've continued to have a clinical practice 1 day a week.
Awesome. Thank you so much for your service. I had another episode with someone, and I was explaining to him how nurse practitioners can prescribe medication. I've worked in a homeless shelter for over 10 years, and I had really good experiences with nurse practitioners over a psychiatrist. And a lot of people don't know that nurse practitioners prescribe. What led you into this field of becoming a nurse practitioner?
Well, I guess first what led me to be a nurse, and this goes back to the 1960s. There weren't a lot of options made available to me by my family. My mother expected me to be a teacher as she was, and so being the rebellious person I was, I picked the other field I could think of. It probably, looking back, wasn't as happenstance as I say right now, because I think I am very drawn towards the helping profession. And then 2 years into it, I realized I hated being in hospitals. They made me very anxious. And then I heard about this program at Penn called Family Nurse Practitioner. And I thought, well, that sounds like something I might like. And let me try that. So, I was young and dove right into it.
Nice.
And I love primary care.
Nice. And your experience in Philadelphia, what has been your experience over the years working in the different clinics?
I have worked primarily in Philadelphia, actually entirely in Philadelphia as a nurse practitioner. And while I was running the health centers, I spent about a half day a week doing primary care. So I have over the years developed a practice. And I love it. It's added a lot to, what I imagined retirement would be like. I think it would be a little bit empty if I didn't have this in my life. I love my patients.
Do you take a holistic view on your patients when dealing with them? Nurse practitioners, I think of a medical model. What's your way of looking at the issue?
The short answer is yes. The longer answer is to tell you a little bit about our community health centers, because they are all nurse practitioners giving the primary care. So we have a very holistic approach. And not only do we have primary care, behavioral health, and dental, and a number of empowering programs for women and youth, we also have meditation and yoga and massage provided by mind-body educators. And that is available not only to patients, but also to staff. So we're very strong believers in caring for not just our patients, but our staff, because we don't want them to get worn out. And we want to continue to empower them and really feed them with a lot of nurturing.
Wow, now that's different, the staff portion. A lot of times people are doing the work, but the environment doesn't necessarily promote wellness with the staff. Do you find that that's been a lifesaver to like not having a high turnaround, being able to provide like an environment that really promotes it all around?
I would say we have really good retention among all our staff at many levels. I mean, I think nurse practitioners working for a nurse practitioner in a nurse practitioner-led operation is much more satisfying than other opportunities that they might have. It might not be the highest pay, but we do pay people respectfully, and we treat them respectfully, and we give them a voice. For example, during the pandemic, I haven't been the executive director anymore, but I have seen the culture that I believed in being followed through, and staff being asked, what do you feel about coming back and in the office full time, and what are the obstacles, and really giving a voice to the staff so that they are really a part of the organization, a crucial part of the organization.
Nice. And with you spending most of your time in low income areas, Can you tell people a little bit about the barriers with the healthcare system here in America um,
Sure.
that people tend to struggle with that may not be common knowledge?
Sure. Some people continue to struggle with access to healthcare because of not having health insurance. What's different about our community health centers is number one, you can come even without health insurance and get a full array of services. And number two, fortunately in Pennsylvania, we have expanded Medicaid. So we have people who actually enroll our patients in Medicaid and in the Accountable Care Act, Obamacare. So we went from having a 30% uninsured to 10%. But even though we were providing a full array of services, if somebody comes in and you think they have appendicitis and they have no health insurance, we can't take their appendix out. They have to go to the hospital and they have to deal with not having insurance. But that problem has largely gone away with the Affordable Care Act and expanded Medicaid.
Wow, so that was a game changer because you were still working at the center when that act happened.
Yeah, and it also, because we had fewer uninsured people, our income went up, and that's when we hired mind-body educators. We also have vans that transport people to and from their appointments. We have community health workers that help people keep track of important things in their life having to do with their health. So I like to call it sort of a wraparound, or a really holistic word that you use is a good word, very nurturing. I mean, I've had patients tell me that to be part of a pain management group has saved their life. And to be part of Mind Body Educators has really transformed them.
Nice. I really love that. And I think about even now with the introduction of telehealth, because I'm in private practice as a therapist, and before the pandemic, insurance wasn't paying for everyone to have telehealth and, access to getting into an office and having that time to do so. I'm hoping that now, the healthcare system, they take a nice look at some of the arbitrary rules they have and allow a little bit more of an expansion of care to happen.
Yeah, I mean, the telehealth has been new and a real opportunity for some of our patients who have many children, or for one reason or another have difficulty mobilizing to get themselves to the health center.
Yeah.
And a lot can be managed over the phone, which has really been very eye-opening for me.
Yes. And so you retired right before the pandemic, correct?
Yeah, a little over 2 years ago. Yeah.
Wow. Okay. And I tell people I went into telehealth full time. January 2020 was my first month, and so I was prepared for the remote life. So it kind of worked out. Now, one of the things, so you're a nurse practitioner, you still do that on your own, but you've been doing this for many years. But you ventured into a new world and this book called Tattoo Monologues. Can you talk to people a little bit about this venture that you started and why?
Sure. I would say it goes back to about 18 years ago, when I first discovered my son lying on the couch taking a nap with a tattoo on his shoulder. And I freaked out. I have two children. Of my two children, he is an adopted child. And I felt like I had to either, join him or lose him. And this was important to him. And he's 35 years old. He has many tattoos. And so I decided I had to sort of open up and get into this. And I guess about 15 or so years ago, he came with me and I got a tattoo, only one. And I'm never going to get another one because it was extremely painful. But, he came with me. And so that was the beginning of my even thinking about tattoos. And as I began to think about them more, I paid attention to them in other people. And I started asking my patients, probably more women than men seek healthcare at this age in their, sort of middle age. So I have a preponderance of women. And so I would ask them about their tattoos, and I started hearing stories. And I said, well, someday after I retire, I'm going to do a book about women and tattoos. And then, I thought, someday doesn't make any sense. Do it now. So I said, not going to wait till I retire. I'm going to fit it into my life some way. And I began to interview. First of all, I found a photographer who would work with me. He actually videotaped all the women and made a video, which is lovely. And with the book, there's access to the video. It's actually on the website. So actually anybody has access to it. So we started interviewing women, and there was a theme that emerged. And the theme was about some kind of life difficulty that was portrayed in this tattoo. So we decided we were only going to focus on tattoos that had a story of trauma or some kind of life difficulty, and try and understand what that meant.
Nice. I want to unpack a little bit, but before, for my audience members who everyone has mostly seen me because I'm always on social media, but I have a full sleeve on my arm. And my first part of my sleeve is a quote that says, "It's beauty in the struggle." And so when I got the proposal for you to come on, and I thought, like, about how many of my tattoos, like, there is a story behind it, and there's a misconception about people with tattoos, like, mislabeled. And so I was excited to hear about your mindset behind this. When you decided, you went from someday into why now, why was that transformation different with your reframing? Because this is a part of life that people struggle with. I hear someday a lot. And it's like, what does that mean? Tell people what got you to transform into why now, because that's important.
It's a good question. It's a very simple answer, and the answer is someday may never come.
Yeah.
And today is what counts. So that's why I did it. And also I was kind of chomping at the bit to get going on this. I thought it would be really enriching. And in fact, it has been. I had no problem at all finding women to be in this book. In fact, since the book has been published, I've met so many women I wish were in the book. Just yesterday, I met someone who had a horse on her arm because she had the devastating loss of her horse dying. I've read about women who have been struck by lightning and have PTSD after that and have some brain trauma, who have tattoos. I meet people in stores. I meet people in the gym, staff, patients. I mean, anytime I talk about, somebody knows somebody. So I could have gone on forever with this book.
Mm-hmm. Can you give my audience an example of without going into too much detail of a story in the book that I know they all intrigue you, but maybe one that kind of stands out?
Sure. It's actually the first one I did, and this was particularly poignant because the person who was featured in the story worked with me, and she worked very closely with me. She was actually my administrative assistant. And her daughter also worked in our office part-time, and her daughter lost her life in a car accident. And it was tragic for the family and tragic for our staff because we knew her so well. And she was not someone who had tattoos in her vocabulary at all. But she wanted something in memory of her daughter. And she had her daughter's name in angel wings on her back. And the reason that was some significance for her putting it on her back, because her daughter always had her back. Her daughter helped her care for her disabled twin sons. And that's one of the stories that kind of sticks in my heart in a very, very big way, because both of them were important in my life.
Wow, that's beautiful. And I hear these stories all the time. And what do you think it is about the pain that people have to endure to get that? Does anybody ever talk about that piece of the pain that happens prior to this art that comes up alive?
Sure. I mean, it's true that when one gets a tattoo, one really makes a commitment, a financial commitment, commitment of enduring physical pain, giving up space on their body, time. So it is a major commitment to get a tattoo. And I've heard some interesting stories from a few of the women about the pain, physical pain, having some meaning for them. And I'm not sure I totally understand it, but it sort of described as making them feel alive. And it brings to mind people who do cutting. And not being a therapist, I couldn't talk real intelligently about that, but that's really what it made me, that's what it brought home to me. Now, I didn't hear that from all women, but I did hear it from some women.
Oh, that's good. And I've never been a cutter, but when I talk to people about cutting, I understand what they're saying because of the pain that I've felt with the tattoos. Really, like it feels like a lot. That's literally the word I would use. You feel this. You start to feel, and I think it's an experience that some people kind of associate with going to get their art of work done.
Sure. I also have heard the word several times that the tattoos were addictive. And I don't know if that's something that you can relate to at all, but that is a theme that came up many, many times.
Yeah, they are.
Yeah.
Now, do you go into some of the misconceptions that happen with people with tattoos, and like how people have been able to manage that, if that's the case?
If you're asking me if that was talked about in the book, the foreword of the book is written by Dr. Sandy Bloom, who's a psychiatrist. She's internationally known for her work in trauma, and she's actually in Philadelphia. And I was after her for 2 years to write the foreword, and she actually wrote quite a several-page discussion on tattoos and talks about the stigma of tattoos, that people often think of drunken sailors or inmates as the people, or gang members, so real negative connotations. And she herself really was enlightened by being a part of this project for me. I mean, she didn't have any tattoos and described herself as having an old weathered body and not having any intention of getting one. She even talked about her parents and how her parents would view tattoos. So in addition to talking about trauma, which is her expertise, she really talks a lot about the stigma and the misconception that people have about people who have tattoos on their body.
Wow. And with the book not having not been out, and to like have her be a part of this project, did that feel good to hear somebody really have an eye opener? Because this is kind of what you would like to happen when people get a hold of the book.
Sure, I was actually thrilled to watch her her sort of her growth during that period of time as she wrote her forward. I also have a Bryn Mawr social work professor who has written part of it, who herself has had trauma and has tattoos representing them. And she talked also about, here I am, a professional, I'm a therapist, and I don't fit that category that people often think about when they think about tattoos.
Mm-hmm. Mm-hmm.
And she made a point of, everybody has tattoos. Professional people have tattoos. Lawyers and therapists and nurses and, all have tattoos. And people of all ages. Like, I am amazed at the patients I have in their 60s, 50s, 60s, and 70s who have tattoos. So it's not, because we also would think of them as something identified with youth. And that is really not the case anymore.
Mm-hmm. Mm-hmm. And when it comes to, the way people like choose to heal, I love the fact that you kind of focused on like people that have dealt with trauma. And I think it also, I'm just curious about your mindset about this, but I think it can also open up people's minds around what healing means to people, or how people heal, or how people process, where it's not just a straight line. It's not just the one thing. It feels like it's incorporated to their process of healing.
Sure. We know that people heal in many, many ways, and being in the presence of a caring professional is one of them. And we're hearing other things now about, I don't remember what it's called, but I know rapid eye movement, and there's actually something else with the limbic system that I've read about. And now we're hearing about use of psychedelic drugs. So there's all kinds of ways that people heal. For women or men also who have been traumatized, they won't get a tattoo until that trauma becomes something that enters their conscious. And as you know, as a professional, sometimes those traumas stay very, very buried. And in fact, one story is about a woman who, as an adult, got an apartment in a basement apartment, and she began to have memories of being sexually molested by a neighbor in a basement. So it was the basement that sort of brought that up for her. And that person's last name was Wolf, and she actually got a Pacific Northwest wolf inked on her body as a way of sort of taking back and owning the word wolf. And we see that in other segments of our society where negative things are turned into something positive when someone says, "I'm taking it back and I'm going to own this."
Mm-hmm. And then the importance of owning it and taking it back. What does that do for people when they do that?
I think it gives them a sense of control, and it
Yeah.
takes them out of being a victim and into a much more powerful place than they otherwise might have experienced.
Mm-hmm. Mm-hmm. That's really good. And where do you see this? I mean, because when I think about this book, where do you see it going? Do you see it being a film, or because I can totally see that happening down the road?
Well, gee, thanks. I'm not sure I imagined. Well, we do have a video. It's about 19 minutes long or so. And we really haven't done much with it except putting it on our website. As far as where this book is going to go, I really have no idea. I mean, I have invested an amazing amount of resources, including dollars, into this book. And I didn't do this book to make money, and I chose the most expensive way to go with a self-publisher, a hard-covered book, really nice paper to show off the photographs. And, I had looked at much less expensive ways to do this, even through Amazon, and it just would have looked crappy. And I felt like I owed it to myself and to the women who took the time to tell me and bare their souls to do it right. And if I wasn't going to do a really good job, I wasn't going to do it at all.
Well, who would you say the audience is for when it comes to the book?
Well, you were intrigued by it, so it could be therapists or other healthcare professionals, people who work in the medical field, possibly women, people who've had trauma in their lives, people who have an intrigue and a love and possess tattoos. So it could go in many directions. I'm right now communicating with someone from Villain Arts. They are putting on in Philadelphia a tattoo convention this weekend, and I may be spending my weekend there, sitting at a table with my books. So I don't know. It may not sell much at all. I really have no idea. So we'll see.
No, we're not going to take that into existence. It will so much. And I also think about, the self-help category, just because you don't have to want to have a tattoo to listen to a story. I think storytelling is very powerful, and just kind of listening to people's process around their journey, I think can really give people hope. So I definitely would not count that category out as well.
Mm-hmm. Mm-hmm.
How does that sound to you?
See, come back in a year and I'll tell you.
That. So if people are intrigued by this and want to find the book, how could they find the book?
I'll give you three options. One is Bookshop, which is my favorite. The second would be Barnes & Noble, and the last, and I'm putting it last for a good reason, is Amazon.
Barnes & Noble, Amazon. Okay, so is it on the website as well?
Right now, you can't purchase it on my website. I don't have it set up for that, but I will when the book officially comes out in October. So I'll have that.
And then, if people wanted to find you, how could they find you?
They can email me at tattoomonologues@gmail.com. That's probably the best way for them to contact me, and I'd love to hear from them. Yeah.
And then for people to listen to the video, how could they watch the video?
They could go on the website Tattoo Monologues, www.tattoomonologues.com.
Mm-hmm.
And it's on there.
Anything else that you want people to know about this book or about you?
Oh, I just said it was a joy to write the book and to interview the women. It was the most fun part of it. Getting it published was the hardest part of it. I just have one more story I'd like to tell if we have a minute or two, and that is about a woman in her 80s who had a breast cancer and had a bilateral mastectomy. And the night before her reconstruction, she awakened and said, I can't do this. I'm not going to do this for a variety of reasons. Just didn't want to go through that surgery, but struggled with looking at her bare chest. And she's a social activist and environmentalist. And so she did this, and this is in the book. Her entire chest is covered with flowers and bees and birds.
Wow.
And, she ran a marathon. At the end of the marathon, she tore her shirt off and bared her chest. And
wow.
yeah.
Oh wow, that's so beautiful. There's just I mean, we just on this episode we heard like 2 stories, not in detail, but just 2 stories, 2 different stories that are very powerful. So, you know, I just kind of I love listening to story. I mean, this whole podcast is about sharing people's stories because that's how I've been able to heal, is realizing I'm not alone, despite the type of way that people healed. So I just can see how this can really inspire people. Even just you going from like someday to why not now, that little sentence is going to trigger for somebody. So there's just so much about you and what you do and how you've done it that is very inspiring. So I just don't want you to ever forget that.
Thank you so much. I really appreciate hearing that, Celeste.
Yeah, you're welcome. Thank you so much for spending time with me. I really, really am excited for you in this book, and just knowing your why just makes me even more excited. So thank you.
Okay, thank you so much for having me. It's been delightful.
Okay, bye-bye.
Bye-bye.